Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone. Welcome to today's professional. Today, we're going to talk about the Lima Dental Associates, and with us in the studio is Dr. Wesley Shankland. Good morning to you, Doctor.
Good morning, George. How are you? Good to see you again.
Terrific. Good to see you also.
Thank you.
What are you going to talk about today?
Today, I'd like to talk about something that people don't talk a lot about, but it affects a lot of people: dental sensitivity.
Really?
And I'm not talking about hurting your feelings. I'm talking about sensitivity in the mouth.
Oh.
You know, there are a lot of reasons why we have dental sensitivity. One, many people can relate to if they have a filling done or a crown done. We'll always have some sensitivity after that. It's because when you do a filling on a tooth, you actually do a tiny operation, which can make the nerve of the tooth a little bit sensitive and somewhat sensitive after a while and inflamed. But that goes away generally. But a lot of people have generalized sensitivity throughout their mouth, and that can be from a lot of causes. A primary cause can be clenching the teeth. And we talked about that a few times before, but if one clenches or grinds their teeth, and all their teeth become sensitive to cold things like ice cream or yogurt or cold drinks, they ought to come and see us because they may be clenching and grinding their teeth, whether they have headaches or not, but they can have sensitivity from grinding. Another reason somebody may have sensitive teeth is if they brush too vigorously. Now, we want people to brush their teeth at least twice a day, but some people are really crazy and brush vigorously, and it causes some gum sensitivity or gum recession, and it exposes a portion of the tooth called the root surface, which was never intended to be in the mouth exposed anyway. That's sensitive to cold drinks and to sugary things and to sour things. Yeah, it does hurt. You know, we've all had that, some probably. Right. And I hate to say, but as we get older, we all have that some a little bit.
Yes, yes, we do.
But we also have sensitivity due also to just sometimes if people have clenched their teeth a lot and they sleep and they have sleep apnea, that causes it too. But the grinding of the teeth, the brushing vigorously of their teeth too vigorously can cause gum and root sensitivity. And there are ways we can treat that, George.
Yeah, I was going to ask you, what about treatment?
Yeah, there are ways we can, the best thing would be is to buy some of the commercial toothpaste, Sensodyne or some of those. But if it's generalized, if it continues on, they can come into the office and we could put a special material, special desensitizer on those teeth to make them immediately be desensitive.
Okay, no time remaining. What about the Summer of Smiles?
We have a Summer of Smiles now on Facebook at Lima Dental Facebook, and we're having it in a contest where we draw, I think, 3 winners a week, and they get a whitening of their teeth. It's really nice.
Okay, we'll talk more about this later on, too.
We sure will.
Thank you, Wesley.
Thank you.
That's our report for today from Lima Dental Associates.